see.
So just hello.
We shall see. There we are. Hi,
Hello.
everyone.
Hello,
I think we're live.
everyone.
Say hi.
I think we're live. Hello.
This Gavin today is not feeling well at all. He's actually been really sick the
Yeah.
last few days.
No, actually yesterday, right? It started yesterday.
Yeah, but yesterday at 1 a.m. So,
Yeah, so
yeah, close to 2 days.
Yeah.
But he wanted to come and at least say hello to everyone.
hello everyone.
Hold on, let me make sure that we are live. Folks, if you're there, say hello. Please let us know if you can hear us.
Yeah. Let us know because we're using a new camera, so can you let us know if it's okay?
Can you see us and hear us?
Yeah, exactly. As
Oh, goody. Okay. This is, so Gavin's going to leave because he's sick, but we wanted to introduce you to Azzy because Azzy is actually relevant to our topic today. Can everyone see Azzy? You know what our topic is today?
She looks so uncomfortable. I'm sorry.
She's actually a funny cat that lets you do this. Of course, watch this be the one time we do it and she like loses her mind. So, hi Jenna. So this is Azzy, and we thought we'd bring her out to say hello because we're talking about different types of allergies.
Oh, we are?
We are. And some people think that skin... No, that's the allergy for the pet. This is about, if skin allergies and pet allergies or food allergies are the same thing. And they're not.
Such a cute cat.
They're not. But we thought that'd be great to sort of illustrate with Azzy here. So we'll give it just a few minutes. And
hello everyone.
Hello everyone. So yeah, we'll give it a few minutes for people to know we're live and join.
No, Azzy, no.
Azzy is the craziest, most tolerant, patient cat we've ever had.
Her full name is actually Aziraphale.
Aziraphale is her name. She's a rescue kitty.
Yeah, we nicknamed her Aziraphale Triller McSqueakerton because...
Aziraphale what?
Triller McSqueakerton.
Triller McSqueakerton. Because she squeaks.
Yes.
Don't you, Azzy?
Yeah. Every time she hits the ground, like jumping, she's like...
Yeah, so she's a little...
She's a little, like, scared.
She's a little nervous now. She's not used to... There, Nina saying hi, Gavin.
Hello, everyone.
And yes, we do have a kitty cameo.
No.
But today's... I'm looking at the wrong camera. Still getting used to this. Today's topic is really complex. And I actually struggled a little bit to try to...
Wait, I forgot
make sure we could talk about it. It's allergies.
Oh.
So people sometimes think, prick tests and patch tests are the same thing. Do you know what that is?
Patch test is like, it goes on the skin and then...
Goes on your back.
As you know, you're not allowed to go there.
Not yet, sweetheart.
Not yet.
We're still gonna use you as a mascot.
Yeah.
Well, so a prick test is they prick your skin.
A patch test is like they put something on your skin.
That's right,
and
on
then,
your back.
Yeah, on your back.
Yep.
And then they test for like blue dye, red dye.
What you might be allergic to when you come into contact with it, when you touch it.
And
a prick test is for things like food, dander, kitty cats, dogs, pollen, nasobronchial stuff. So there, in about half a minute, I think I can start because it is quite complex. And Gavin will be leaving us, unfortunately, because this kid had a raging fever. It was like, for those who are fellow geeks, I'm a big Star Trek geek, but every year we watch like the Lord of the Rings trilogy just to try to stay awake till New Year's.
Lord of the Rings and The Hobbit.
Yeah. And yesterday was like fighting the Balrog. Do you remember the Balrog?
I do.
Oh my gosh, his fever just wouldn't go down, and it's still not all the way down today. So he's not going to be joining us, unfortunately. But for people who are just joining, say goodbye, Azzy, and say goodbye, Gavin.
Say goodbye.
Is he stuck? She's stuck? Bye-bye.
Yeah. Bye-bye.
Bye, Azzy. Thank you for being a prop. Sorry.
Oh.
Sweetheart, go get your walk.
All right.
Feel better, Gav.
Ah!
Okay. She wants to go for a walk already. All right. So, thank you guys for joining us. This is our Skinsights on allergies. Are they all the same? Are skin allergies the same as food allergies, as pet allergies, as pollen? Remember to ask your comments early. I will be checking better this time to make sure I get your questions, especially about VMV. Make sure to try to get them early, because when my mom comes in, who is our founding dermatopathologist, we're going to be focusing on skin. Really skin issues, and this topic in particular, because it is extremely complex. And so don't forget also, anyway, to get your questions in early so that we can make sure that my mom gets a chance to answer them, that I get a chance to answer them. And don't forget to comment. We'll be giving out today a a starter-sized Red Better cleanser. I don't know if that's visible, but it's really cool. And we have actually a video. I just did one on our Red Better line, hyperreactive skin, red skin, and rosacea, which is up on YouTube. So check that out. And stick around till the end of the live, because we will be picking our winner for today from people who ask questions or comment. And please don't forget to like us on Facebook and subscribe to our YouTube channel and follow us on Instagram, etc., etc. I'm going to jump into this topic because it's really complex. And I think that's the first thing I can share with you guys, that we always hear, I'm allergic to almonds, so I can't use skincare with an ingredient that is extracted from almonds. Or my eczema flares up when I eat mangoes because my prick test shows that I'm allergic to mangoes. And it's just not that straightforward. So the main thing sort of to take home, if nothing else, is that different cells are involved with different types of allergies. That's sort of the main thing. If you've prick tested positive to something, and let me actually back up a little bit and make sure we're clear here. A prick test is pricked. It's done on another part of your body to determine if you were allergic to certain foods, dander, pollen, dust mites, typical stuff that we think of when we think allergies. A patch test is not pricked. It's applied on your back. It's just sort of taped on. And then in a few days, it's red, right? To see what you're allergic to when you come into contact with it. When you prick test positive to something, it is actually highly likely that you can still apply it on your skin, unless you have also patch tested positive for it. So patch test is really specific to skin, and a prick test does not really easily correlate with skin. So breaking that down a bit, mind you, again, this is complicated, so I'm not going to be sort of diving deep into this. I will leave that to my mom, who is the expert in this. But basically, there are 4 types of reactions that we tend to have. Type 1, 2, 3, 4. 2 and 3 are more irrelevant for what we're talking about today. What's relevant to us now is to this topic, let's say food, dander, nasobronchial allergies versus skin allergies, would be type 1 and type 4 type reactions. Type 1 reactions are IgE modulated, and they involve antibodies. And this is the reaction we normally think of when we think of an allergic reaction to like a food. You get anaphylaxis, you have difficulty breathing, hives, maybe urticaria, you'll puff up, right? This is IgE modulated. This is a type 1 reaction. And while there can be some delayed reactions, always for this type of reaction, type 1, IgE modulated, involving antibodies, there will be a reaction within 60 minutes. It's quick, because it's a fairly direct relationship. We all have IgE already in our bodies. When it's triggered, boom, it reacts. And that's quick. And this is usually, type 1 reaction is asthma, nasobronchial stuff, the sniffles, pets, dust mites, pollen, and food. But food is a lot more complicated. I'll touch on that a little more later, but this is the type 1 reaction. Type 4 reaction is non-IgE mediated. Tell me if I've lost you already, and we'll break this down further later. Type 4 is a non-IgE modulated, and then we'll explain that later, and does not involve antibodies. Type 4 is contact dermatitis. So type 4 is not immediate, quick like type 1. because it's a longer process. It's a more complicated pathway to a reaction. Among other things, you first have to, a sensitization has to happen. Sensitization can happen over a week or many, 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 many weeks. So the reaction actually isn't all that immediate. And it can take a week to many weeks. It is not IgE mediated. Instead, it is T cell mediated, and no antibody is associated. So they really are quite different modalities, quite different systems, right? You're not, we're not going to test anybody to this, so you don't necessarily need to know all of that, but in a nutshell, it's good to know they really are quite different, food allergies and skin allergies. There are many more types of food reactions. I will not get into them in detail, but just to give you an idea of how complicated this is, food reactions include IgE mediated, which is what I discussed earlier, so strawberries, peanuts, that kind of stuff. Non-IgE mediated, which is, for example, food protein-induced enterocolitis, and it's usually outgrown. It is T-cell mediated. Again, there's just a lot. There's also other stuff like toxin reactions to pufferfish. Drug reactions, internally taken, are really hard to isolate. Even food reactions, frankly, are hard to deal with because it's so complicated. When you get a reaction, you're not quite sure what you're reacting to because there's so many substances in one food. Much more so in a drug, which is why prick testing for drugs is really quite rare. There is for penicillin, but not for a lot more, because a drug, the compound alone, is already so complex. So where it gets a little more complex for skin. So again, backing up a bit, right? There are 4 types of reactions generally. We're talking here about type 1, which is mostly dander, asthma, nasobronchial, pollen, food, and then type 4, which is contact dermatitis. There's IgE modulated for type 1, non-IgE modulated for type 4. Antibodies are involved in type 1. Antibodies are not involved in type 4. In type 1, the reaction is boom, quick, within 60 minutes. And there can be some delayed stuff, but something quick happens right away. With contact dermatitis in type 4, a sensitization has to happen first. Where it gets more complicated for food is there are many different types of food allergies. That's why you need an allergist who's very good, who can go through your prick test with you and your case history and correlate things. For skin, where it can get a little bit more complicated is in atopic dermatitis, which is a kind of allergy of the skin. And it's so complicated that there are actually several theories that are still in play. It's not sort of one, yes, we all know and agree that this is the thing that causes it. Inheritance, we know, plays a factor. Another theory is regarding the overpresence of overreactors. I have an autoinflammatory disease, and I have an overpresence of overreactors. So I tend to overflare to certain triggers. In atopic dermatitis, the theory is if you have too much of these overreactors, that might be contributive to the atopic dermatitis. It might also mean an overreaction to certain foods. And atopic dermatitis, very often, contact dermatitis is a factor. It's in play. And then there's also atopic march, which is if you had eczema as a kid, you could be more likely to have asthma or nasobronchial allergies as an adult. So pretty complicated. So I'm going to be happy to call it my mom in just a bit. But back to the simpler stuff. If I'm going to leave you with anything, it is just 4 things to remember. One is prick test is IgE antibodies and can be more complicated. Even if you prick test positive to a food, like shellfish, for example, your allergist will correlate this to your history to make sure if you can really eat shellfish or not. The second thing I'll leave you with is a patch test is much more straightforward. If you patch test positive to something, you shouldn't come in contact with it. It will cause an allergic reaction. If you prick test positive for something, unless you also patch test positive for it, the chances are really good you can use it on your skin. So for example, if you prick test positive for almonds or coconuts, the chances are you can use, say, mandelic acid or coconut oil on your skin. If you patch test and prick test positive to something, however, then you need to avoid it in food and topically, for example, nickel. If you patch test positive to nickel and prick test positive to it, you will react to it when you touch it, like in a phone or in your glasses or other metals, and also if it happens to be in your food. I'll segue really quickly here, and then we'll bring in my mom, and we'll get into this in more detail. As a practice at VMV Hypoallergenics, we make it a real point to make it easy for you to follow your patch test. So the VH number shows, for example, like in this, VH minus 109, over 109 is without all 109 contact allergens. If there's an allergen, it'll show something like this, 108 over 109, and there's an asterisk. And then what's handy dandy is then if you go to the ingredient list, right, you will see that there you go. The allergen that's included, in this case vitamin E, tocopherol acetate, which is a great antioxidant, is underlined, and you can identify it quickly. So if that was on your patch test, you'd need to avoid this product. And if not, the chances are you can use it. So yeah, we take it very seriously. You can shop all our products at vmvhypoallergenics.com internationally, vmvhypoallergenics.ph in the Philippines. In the USA right now, we're doing a Re-Everything Eye Serum, which is awesome. You get a free Re-Everything Eye Serum when you shop a Re-Everything Eye Serum. You also get, I don't have the toner, but it's a free starter kit of Super Skin Starts Here set, which is awesome, a great way to start a regimen. And then locally in the Philippines, you get a starter size skincare product, whatever is available in the store when you shop at VMV Skin Specialist Boutiques. And remember as well, in the Philippines, our clinic and research center does sell the monolaurin pellets if you're fighting infection, as we are in this house right now. And we can help you book a teleconsultation with my mom or other dermatologists or nutritionists that we work with. And for everywhere, you can share your patch test results with us, and we can help customize recommendations based on your results as well as possible cross reactions. One last thing before I call in my mom. For a patch test, you would see a dermatologist. For a prick test, you'd see an allergist. Some allergists also do patch testing, but if you have a long history of reacting to stuff, we would recommend getting a patch test from a contact dermatitis specialist because they are specialists. Therefore, they're really into the reading, they're really into the research. They probably have more types of trays available, and reading a patch test can really benefit from a lot of experience because it's not always so easy, even for expert doctors. So we do patch testing in the Philippines. If you're interested, drop us a PM. In the United States, look at contactderm.org for a patch testing doctor in your area. In other countries, look up your dermatological society's contact dermatitis specialist group, and they can, I'm sure, help you. And speaking of contact dermatitis specialists, finally, and patch testing, I would call in my mom, Dr. Veralia Rowell. Hello.
Hello, my dear.
So I sweat through that a little.
This little kid over here had quite an evening last night.
All day yesterday with the sick kid.
With a sick kid, the temperature went up to 39. So
40. 40.5, 104.
40, there you go.
So anyway, I mentioned she is a contact dermatitis specialist. She's been forever, since her earliest years as a fellow in the United States. She and I had a lot of back and forth about prick testing and patch testing, so I wanted to make sure to get an updated clinical take on this. Say hello to everyone.
Hello, everybody.
Okay, so don't
Welcome
get your
to
questions
our
in early, folks.
Welcome to the world.
So we're sure that we can answer them. Good morning. Yay. Our friends again from Nepal are here.
How are you?
Okay, so the first question I wanted to ask is, I actually sort of went through it a little bit, but perhaps you can help. There is a difference between a patch test and a prick test.
Yes.
So when you get a patient, for example, who says, oh, doctor, I really can't use coconut oil because I'm allergic to coconuts. Mm-hmm. My allergist says I'm allergic to coconuts. How would you normally go about that?
Okay. We have to go to the basic part, which is what she was talking about. The prick test is different from a patch test. The prick test is the kind of a test that your allergologist will do to you, for you, when you have an allergy that within an hour makes you already have hives or neurotic edema or swelling or difficulty in breathing, rush you to the emergency room and things like that. Or you eat certain foods and you're choking or you're having rashes or, things. So, or you're inhaling and you're sniffling and, having difficulty in breathing again and all that. That's more what we call an IgE mediated, a quick, rapid response of the body, because the antibodies are already, talking COVID, we're talking about antibodies in COVID times. Well, that same kind of cell, or rather material that is produced by certain cells in the body. They are called antibodies.
They're already
the
there.
antibodies called IgE, they're already in place, either because you've already been exposed to it before and you somehow, your body didn't like it or it was alien to it. Anyway, exposed to it, bingo. You get a reaction quickly because the antibodies are there and they give you the reaction. And that is done with a prick test. Those little pricks that they put on your skin that then the allergologist will read and then gives you a run through over the kinds of things that you should be avoiding. That's a prick test. On the other hand, a patch test
Is on your back.
is totally different in the sense that different cells, remember we're talking about this is an antibody, this is a cell. The antibody is produced by different cells from the T cells. The T cells in the skin, circulating in the body, when you're exposed to, let's say, the top ones are nickel and balsam of Peru. When you're exposed to balsams and resins and perfumes and things like that, and the body, the T cells circulate around in your blood and all, and over time, those T cells learn that they don't really like, they find certain chemicals not native enough for them, so that they begin to react to it. And that is called a contact dermatitis. So in order to find out what you're allergic to by contact due to T cell allergen response, we dermatologists put patches in your back. In my clinic, we use the 80 allergen tray as a baseline for. It's made by the American Contact Dermatitis Society, or rather, it's published and looked over and examined regularly.
But there are more. So
there
if
are
your
many
doctor
more.
suspects something else, they might add
Oh, yes,
others to
you
the
can
tray.
have.
Okay, I'm actually going to jump in because we have a wonderful...
And then coconut. Let
right.
me finish the
Oh,
question.
Yes, sorry.
So therefore, if your prick test doctor, the allergologist, says you prick tested positive to coconut, that's different. That's, prick testing. And by the way, prick testing is not as specific as patch testing.
It's more complicated.
You can, it's much more complicated, so that you can actually be having positive tests to a prick test and be able to eat certain foods that you're supposed to avoid. So there's a great deal of discussion between you and your allergologist over what you should avoid or not avoid.
Right.
Okay. So with coconut, it's the same thing that holds for coconut. For coconuts, if you want to find out if you're really allergic to coconut,
To eat it.
there's a type of patch test actually called the Atopi patch test, where the whole plant
This is
or
for
the whole
eating it or for the skin?
for eating.
Okay, interesting.
So this is a midway, where the material, the coconut and lemons and what the other things that they normally use for Atopi patch tests are soy and wheat and things like that, grass and cow milk and all that. They place a little bit bigger, lot bigger, 10 to 12 millimeters. They put it on the skin. They patch test it, and it actually tests for the the antibody stimulating the T cells to react to it. So it's a midway kind of thing. Not too many people do an Atopi patch test, but if you're really curious about whether a certain food will give you an allergy, have an Atopi patch test. I don't bother with it, but one of these days I may.
Okay.
So then the other thing we're talking about is really the patch test, where we have all the allergens.
Yeah.
Okay. Because it has been shown that if we test you for too many more allergens, that the harvest is more, and we can actually identify how many the things that you're truly allergic to by patch test.
So, as a general rule, though, it seems like if I understood what you were saying and what Cece and you were saying the other day, Cece's my sister. We had a long discussion about this to make sure we were, on the same page, or honestly to make sure that I understood it. But if I understood you guys correctly, don't be guided as much for your skin selections by your prick test. Your skin selection
Right.
should be guided by
Correct.
your patch test.
Yes.
Right? Okay, we have a wonderful question. That's why I was eager to interrupt, because it's really quite complex. Linda is asking, I have many contact allergies and food allergies. Can I have a skin rash? Can I have skin rash allergies from food? Right? She's had over 146 patch tests. Maybe 146 allergen, Trey? And I'm still having skin problems. So the first question is, can I have skin rash allergies from food? So if I intake the food, if I eat the food, can I break out in a rash?
Absolutely. There are certain chemicals that are present in the American contact dermatitis core group. When you look at it, there are certain things there that become positive. Then you have to be careful about those things, not just for applying, but also for taking internally or for inhaling. Best balsam of Peru, perfumes, cinnamates, the food chemicals that the extracts of food that you put in order to flavor food. There may be an association. Either you get a little bit of an upset stomach when you're taking them, and you also get a rash in your skin.
But to be more conclusive about it, I would think you would need to
Do both.
Yeah, do both. Prick test and patch test. If you patch test negative and you prick test positive and you eat something and you get a reaction, the reaction may not be what we think of when we think contact or atopic dermatitis. It could be hives. Urticaria is raised welts, like this, the really itchy red raised, you almost look like a map.
Right.
That's not contact dermatitis. That would still be the IgE mediated
Right.
antibody reaction. So it appears on the skin, but it's not a T cell mediated
It's
contact.
not it's not right.
Right. So I guess an answer to that is yes, but you would have to have prick test, or to be more conclusive, you have to take both tests. If you've had,
In addition, especially nowadays, and you have to be very aware of that, there are so many skin rashes that can occur because you've been using steroids over and over and over again in your skin. And they can complicate the kinds of skin rashes that you're getting.
and the readings of
Right.
them. Yeah.
Right,
No, that
because the
changes everything.
steroids, main problem, and it's a common problem because in both atopic dermatitis in particular as well as contact dermatitis, you easily get secondary infections. And when you then add the element of putting steroids,
Topical steroids. we're
topical steroids that thins the skin,
talking. That's really
then
an
you're
issue.
inviting more of these bugs to go in, or even, and we're seeing a lot of it, your own native bugs to become powerful.
Yeah.
So
You
they
know,
grow.
So I guess, Linda, the other thing I would ask is, if you've had 146 allergen tray patch testing already, well, two things. If it's 146 separate instances of patch testing, then a different tray might need to be used, or maybe even a fuller history. If you are on topical steroids, if you are on other drugs that might be complicating things,
Right.
if you're doing a full, like 146 allergens, then interestingly enough, what she does also sometimes is she says, okay, stop everything. Let's just stop everything. What drugs are you on right now? Let's see what we can eliminate that has a correlation with skin,
That's
right? Topical steroids, certainly if you happen to be taking or applying topical steroids
Do it on
fairly
your own, though.
regularly. So here's the thing about, again, topical steroids. If you're prescribed them, they're important, they're miraculous, wonderful, dramatic, etc., and you must take them, you must use them, but only for the prescribed time.
That's right.
They really shouldn't be used for longer than, say, 2 weeks maximum at a time, unless it's a very specific prescription.
That's right.
Longer use has many, many health problems associated with it. One of the things she likes to do when she sees a patient who's been on topical steroids for so long is to first prioritize getting off of the steroids before even doing a patch test. Because the patch test will be, I don't even know. I don't know if you're reacting
You
to
can't patch test a steroid thin skin anyway.
Exactly.
And you can't patch test somebody who's really on steroids for quite a while, because then it will dull the reactions to the patch test.
Or it's so thin already, it's just reacting to everything. So she'll often focus first on getting off of the steroids, then getting the skin sort of to a ground zero, to a baseline state, and then doing a patch test. Now you can practice much more accurate prevention, and then maybe steroids are once or twice a year, you know.
I had recently had a patient that's really amazing. I won't mention any names, so don't worry if you happen to be listening to me. She's a vegetarian, and for years, and really believes in it very much. I had a rash that was just so miserable. It kept coming back and kept, including in the hands. So after I had cleared her off completely, no more steroids, whatever, I did a patch test. But I couldn't stop the medication I was giving in order to minimize the steroid effect. So it was still there. She was still on a similar to steroid, but not having the same side effects as the steroid. Still at this drug, I won't give the name, but it was about 100 milligrams a day yet. And despite that, her reaction to the chemicals, many of the chemicals that she was eating in the vegetarian kind of food and the fruit kind of food that she was eating, was amazing. 2+ reactions. It's pretty strong, especially when still on an immuno drug.
Modulator, So it's kind of important to get off of that.
Right.
But so Linda, I guess if you can also drop us a DM or a private message or a message on our website, and we can help with more questions, maybe to work with your doctor.
And are those 140 all at about the same time or the same short period?
See, those are the kinds of questions that we'd ask.
Or did you have it over so many years? Because that's what we doctors sometimes do, is that I did your patch test 10 years ago, you're back and you're still having what? Rash. Okay, let's do a repeat patch test because they show something different.
Okay, the next question is from Jean. Is it better to get your skin patch tested first if you plan to get maintenance skincare so it will really fit your skin and work better, especially if you have allergies? Yes. Before choosing a regimen.
I didn't hear the last part.
Yes, especially if you have allergies, is it better to get
tend
patch
to be
tested
allergic,
first?
yes, that would be a good idea.
Patch test can be more expensive up front. But what I always try to tell people is, can you calculate how much you've spent on all of the doctor visits, all of the skincare, all of the makeup that you've tried and had to get rid of? And then it's a lot of money.
That's right.
If you get a patch test up front that can tell you specifically, Jean specifically, what you need to avoid, well, that can really help you save a lot in the long run, because now okay, that's a cinnamic related thing, I can't use that. This is vitamin E, I can't use that.
It's got ilang-ilang here.
Then
tea tree oil.
It can be tea tree oil. All these things that we think sometimes are so great and can be if you're not allergic, right? I mentioned lavender in our last live stream, citruses. A lot of these things that are wonderful are top allergens.
And a very much needed ingredient are preservatives. They're very common allergens.
Yeah,
things like that.
Okay, Nina's asking, between a prick test and a patch test, which is better to invest in?
Depends upon the kind of allergy that you have. If we're dealing basically with food allergy and sneezing allergy, as well as hives and rashes that occur immediately after you sat at the table and started on a bisque or whatever, obviously you need a prick test.
Is it safe to say also that contact dermatitis, it would be unlikely to be life-threatening versus IgE?
As a rule.
So there are exceptions,
but the
of course.
very chronic ones with already steroid. I've seen Cushing's disease,
Really
diabetes,
had to hospitalize
suppression of their
people.
thyroid glands, suppression of the adrenals.
But let's say as an
In that way.
in an immediate life-threatening situation, a bee sting,
It's strong.
anaphylaxis from peanuts and strawberries, that can be life-threatening rather quickly.
If you tend to do that, then you should
If you have a
prick
history
test
of that, I would, as a mother for a child, I would prioritize that,
Yes.
right? Because I want to know if my kid needs to walk around with an EpiPen, or if my
There
kid's
you go.
school needs to know my child is allergic to peanuts, right? For a cafeteria, just so that the children are warned. And also so I can educate my kid from a very young age. Also, it's good for you to be able to manage, because you might need an EpiPen on you when you travel, for example, and you might need certain medical clearances. If you have a history of that type of allergy in your family, asthma, shellfish, that type of thing, I would prioritize a prick test over a patch test. If it's skincare, though, remember a lot of the stuff, like she said, can be really chronic and can be a long-term problem. Then it's time for a patch test to make sure you get off of steroids, for example. Okay, these questions are so good. So Anna is asking, this is cute, when I turn red when I drink alcohol. Is that an allergy I can outgrow, or can I consume more to gain immunity? I would go with the latter, but that's a personal preference. That falls under the type of food allergy that's funky.
No, at saka, sorry, but it depends upon, there are certain skin types that are common in certain nations, certain groups of people.
Asians.
Certain Asians.
North Asians in particular.
Blush easily. It has something to do with the vascular system so much, not so much the skin.
That would not be metabolic, like a lactose intolerance, where you don't have the protein.
Different.
That's different still.
That's an enzyme.
Because the food is so
enzymatic.
funky.
Yeah,
it's
right.
really such a headache. God bless allergists. I mean, love your allergist, dermatologist. Just love them because it's a lot of work. So for things like that, where it's just the flushing, and there isn't an associated anaphylaxis, there isn't sort of a urticaria that happens all over the body, then, maybe you just get a bar tan.
Yeah.
And
there
it's
are
a
people
glow.
with sensitive skin. There is such a disease. Yeah, I mean, there's such a condition that we call them sensitive skin syndrome.
My Cece was saying that she ran into something apparently that you can take before imbibing red wine that can reduce the possibility of that flushing. But that's the type of thing I would talk to your allergist about, to make sure you can take that if the flushing really bothers you.
I think the flushing might be a signal for you to stop drinking.
I disagree. Everything in moderation. Everything in moderation, of course. And we support wholeheartedly people who are sober for whatever reason. But, otherwise, if you enjoy a little tipple every now and then maybe a little flushing is something that, to put up with. Maybe. Okay. Lynn is asking, but this is a different question. Hold on. Okay. So maybe I can make this not brand specific. Lynn is asking, so I had contact dermatitis a few months ago, but I'm good now. I'm using a combination of a gentle face wash and a moisturizer with anti-cathelicidins, anti-inflammatory. Can I already use something more advanced, like a serum around the eyes with a more active ingredient?
You have to discover what your contact dermatitis was. Did you in fact have a patch test, and what were the results? Did you just sort of do it by looking over the products that you were using and then deciding that it was due to this? So therefore you go back to that product, and you can do this in your own and look at the ingredients there, and then take a good look at them and guess, I guess, because if you're not doing a patch test, guess which of those ingredients might be the cause. Maybe there's a fragrance, a preservative, a dye, whatever, a colorant. And then look at the serum that you want to use, because there are also chemicals in the serum that might jive or be similar to the ones that produce your sensitivity. Yeah. That's one way to do it.
Assuming there are no top contact allergens in any of the products, then there's a fairly good chance you should probably be okay. You can even do an impromptu patch test at home, right? You apply it. A good space is there's a medical term for this, and I always forget it.
Antecubital?
That's it, the antecubital area, which is the inside of your elbow. You put a little spot of the product there, like a pea size, you rub it in, and you wait, and you observe, right? 24 hours, whatever. And if there's no reaction, you can be extra careful and wait even longer, and then see. But the chances are, is if everything that you're using, which it seems like is fully absent of the top contact allergens, then moving up to something more active should be okay, assuming you do an impromptu patch test, assuming you go very slowly when introducing the new product. You try it, you wait 3 days, you observe, you don't use allergens and other things, then yeah, that should be fairly safe.
And a word of advice from your mother here. Don't buy the expensive product immediately and test it from there.
Get a sample.
Get a sample. Those usually will give you samplers so that you can test it on that. Sometimes I even advise patients, the next night you can put it here now. We're closer to the face and see if
Oh
you're
my
going to-
God, I'm so excited. Okay, sorry, this is a total surprise. I didn't think she could make it. This is my sister, Cece.
Come on,
She also
I'll
works
put you
with
in
us,
the
but
middle.
she's in med school. No, you stay in the middle.
I'll be in the middle.
Yes. And I wasn't sure if she would be able to join us. That's us over there.
But these two are so huge, people. I'm going to sit with a pillow on me.
Isn't she pretty? She's so pretty.
She's fantastic.
There
you go.
So she and my mom were really helping me try to understand prick testing and patch testing.
Sorry.
And Cece, bless her heart, really walked me through everything to try to break it down for all y'all. So
To be fair, I learned, even learning in med school, like learning it to be able to be tested upon it was a very different animal.
Yeah.
Because, obviously we have to be able to understand it enough that if someone asks us a question and a case on it, we can understand it. So it was hard to try to explain. So I'm
Which is
sure they did
awesome.
like a miraculous job today.
no.
What
wow.
makes her a great reference, by the way, person to talk about this
Oh
is
my
that
God, she's a walking sneeze.
she's a walking sneeze.
She is so
She
allergic.
gets angioedema from both aspirin and Tempra.
She can't
You know,
take any type of
no pain,
pain reliever,
no headache,
right?
I
no
mean,
fever.
and
There's like
medication.
one or two.
Yeah, the only painkillers I can really take are stronger ones, so I try to avoid them as much as possible because usually they usually make you a little groggy, or there's sort of I also don't want to build a tolerance to them. See, I am
sniffly.
sniffly. It's in the morning. I'm sniffly in the morning. I'm always sniffly in the morning. My family or my friends make fun of me because wherever I
goose.
go, I litter. I litter Kleenex wherever I
Not
go.
anymore, thank God,
I
since the
don't.
pandemic.
But
so.
like I used to because you knew I was there previously because there was a Kleenex there or a Kleenex box because I just am always sneezing. So,
Okay. I want to make sure, since I have you both here, we get to some questions that are beyond my pay grade. So, what about gluten? When people say they are allergic to gluten,
Sensitive to gluten.
what is that based on? Is that a prick test? Does that affect skin? Meaning, I should not eat gluten, or my skin will freak out.
Can you talk about the molecular basis for that one?
well, gluten isn't actually. You're not actually allergic to gluten.
right.
You have.
You
a-
lack certain enzymes.
Correct. It's sort of the same idea as with lactose intolerance, which I don't know if you guys talked about it at all, but it's sort of the same idea with lactose intolerance where you aren't technically allergic to milk. You are lacking in enzymes that are needed to process milk. So it ends up kind of like instead of getting milk that you're processing that gets transformed into calcium and all of the good things, it ends up just sort of sitting into in your gut and it's not processed. That's a problem because that's very irritating and that causes diarrhea, flatulence, all of the unfun things. Gluten is sort of similar.
Tooting and pooping.
There you go.
Discomfort.
Yeah, that sounds familiar.
With gluten, it's similar in that your body lacks certain enzymes in order to properly process gluten. There have been some new tests on gluten, but I don't know if how scientific or how medically accurate they are. I know that they're being used in certain clinics nowadays. Generally, with some food intolerance, sometimes they actually just test it by having you withdraw from the food. So sort of similar to when we do like a 7-day patch test, right? We try to remove a product.
The skin fast.
So like
7-day
a skin fast.
yeah.
Instead, we do like a food fast. So like
Food elimination, right?
yeah, food elimination diet, where you go, okay, let's try to take away one thing that we think could be the problem. So usually it's like shrimp or peanuts or whatever. But sometimes they'll say, okay, let's try gluten. If there's this particular, because celiac disease, which is gluten, is usually genetic. So usually there'll be a reason for it. So, they'll be like, oh, my mom has celiac disease or something like that. So that's when it'll come up.
Okay, so that's interesting. So celiac disease is what? Specifically?
It's specifically like a gluten intolerance.
So you can test for that?
Yes.
Okay, because there is a difference between people who say, I eat gluten and I feel yucky, versus people who actually have celiac
Correct.
disease. And that is a disease that has to be managed with your doctor. That's not something to sort of self-manage and self-diagnose and whatever.
Because the thing is, sorry, before you
Okay, go ahead.
just before you go really quickly, because wheat, I
You
don't
can
think
imagine what the
people-
family conversations are like.
I don't know if you. I don't think people realize when they think gluten or wheat, they think pasta, they think bread. But gluten is in a lot of things. Gluten is in beer. Gluten is in soy sauce. Like
right.
gluten is in a lot of different things. And so, when people they say I'm not eating gluten and they just don't eat pasta, that's not actually celiac disease, because people with celiac disease have to give up significant amounts of the food options because they're just so strict. Sorry.
For those of you really who have problems with irritant bowel or leaky gut or whatever those terms, I strongly urge you to go see your gastroenterologist, because this is the age of precision medicine and targeted therapies where there are actually biologics that can target whatever is wrong genetically, molecularly in your gut. And I've seen so many. I refer them actually, my patients who have problems like this, refer them to gastroenterologists, and they come back beaming because they're much better with the new biologics that are being given for these diseases.
So it's worth checking.
It's
but
worth
to be
checking with
clear
them.
with gluten, there is a skin issue that is related to gluten, isn't there? It sounds like herpes. I don't remember the name of the term.
Herpetiform?
Something like
Acrodermatitis enteropathica?
there is something, but before, so while I will look this up, because I do remember it, we talked about it before, I just don't have it at the top of my head. I will look it up now. But we do have a question on from Anne. Not sure if this has been mentioned. Can kids be patch tested so moms won't be surprised by allergic reactions? And a follow-up from Nina, if yes, what's the earliest age our kids can be patch tested?
Okay, because they have a very small body, we cannot patch test them to the 80 that I would normally do for an adult. And so it would be a real choosing based upon a good history to try to find out what it may be that's causing the allergy. But the youngest that I've done a patch testing on was somewhat older, 6 months. But I know some people who've done it at a younger age. So 6 months and older, I'll do the patch test.
Yeah, I remember in New York we had one poor kid who I was so allergic, and we couldn't figure out what was going on, and so he had to have a patch test twice because he was I think he was 4 or 5. He was definitely below first grade, and I remember because they had to do it twice, and if patch test is not difficult, but it is
And
a
it's
little
not
frustrating.
painful, yeah.
It's not painful, but it is frustrating.
Yeah.
And
Or it can be for a 4-year-old kid.
yeah, and to do it twice in a
Yeah.
row is not necessarily pleasant. And so I felt so bad for this poor kid who had to do it twice, but he did quite well.
say hi?
Come on, I would like to say hello.
That's my daughter. She has her own stuff too, allergy-wise. So anyway, sorry, go ahead, Cece.
So, it is possible to do younger, and it is possible to do the full array younger. It just takes twice, and
Because their backs aren't so big.
right. They don't
Right.
have that much space,
Yeah.
so you have to kind of
Plan it.
finagle around it.
Yeah.
But it's
and
possible.
It's a little uncomfortable, but it's totally fine. So yeah, as young as 4.
Mom said 6
5,
months.
6
6
months.
months.
That'll be interesting. Okay. So what I was looking for gluten was, you mentioned it, dermatitis herpetiformis.
Isn't specific to
It is.
gluten.
It's not specific to gluten.
No.
So
No.
it's unrelated to gluten.
I mean, it's it's a reaction, a skin reaction.
To gluten enteropathy.
I guess it's possible, with anything that happens with the gut.
Yeah.
There are,
By the way, we have 10 minutes left, guys, so please get your questions in quickly if you want them answered.
with anything with the gut, there are possible manifestations throughout the body because your gut feeds the rest of your body, right? So it is, I suppose, possible for there to be a skin reaction, like as a possible manifestation, but it wouldn't be exclusive to gluten, and it wouldn't happen to everyone. So it would really be on a case-by-case basis.
Okay.
This is a very complex subject that we will be learning more and more as we go on. Remember, the gut is the source for microbiota,
Yeah.
which are the workers of the horse of the body as well, and those are affected when you have gut problems.
Yeah.
So you'll be hearing more and more about this, and where we might be even be able to make use of them in the skin.
It's exciting. Okay, is it possible to be patch tested? Is it possible that your patch test is negative for a certain allergen but still get a skin reaction?
You can have a false negative.
Yes, very often you might get false negatives. You were tested when you were still on steroids, or you had been on it for so long and there was not enough withdrawal period from the steroids so that you were non-reactive, for instance. That's a very good example of somebody who will have a negative. Definitely, you can have a negative test.
But usually that's why a good...
Or the allergen that was tested on you was already expired.
Okay.
I mean, it can happen. I mean,
Right.
you know.
Or, for example, there can be variations of ingredients that gets really tricky. So, for example, what you are allergic tested to might be slightly different to the ingredient that is in
Very
your,
good point. Yes.
That's
product.
true.
Excellent.
That's
Excellent.
very
Excellent.
true.
Yeah.
They can be related and you don't even know it.
Right.
Some of these cross-reactants are tough. Okay, what specific skin conditions are caused by food allergies, if any?
Well, I suppose that I don't know if it's caused by, but there's something, it's called the atopic march, which there's a theory that all sorts of allergies are sort of connected. So, for example, if you had a food allergy, you might be more likely to have atopic dermatitis, or I think it might be the other way around. But either, like, there's the idea that, like, all of your allergies, whether it's, like, allergic rhinitis, so, like, what I have, the stuffy nose and the sneezing, asthma, atopic dermatitis, and food allergy are all sort of connected. It's not necessarily that food allergy causes the skin issue, it's just that they're all coming from the same sort of initial, like, immune problem, and therefore can cause atopic dermatitis or skin issues can be a part of that, as opposed
But
to...
it's not a contact dermatitis.
No.
Okay,
Right.
let me just tell you about atopic dermatitis and contact dermatitis. Years ago, we were kind of, you've got atopy, you've got atopic dermatitis, that's it. You don't get contact dermatitis. Well, guess what? You can have actually T-cell mediated, that's contact dermatitis, and in an atopic dermatitis, and quite often. It's now been reported quite a bit, and so this is what I do. Atopic dermatitis patients, when they come in, I try to clear up their skin with various other things and listen to the allergologist and work with them as well. Then try to clear it up so well so that eventually I can do a patch test when I have certain clinical signs that make me think there is an allergy here by contact. Example, only the left hand has an allergy, and only the left hand has it, but it's only in these fingers and this one. The rest of the hand is okay. That to me is a signal for patch testing to find out what you might be allergic to, because you've had it for a long time and everybody has given steroids and nothing has happened.
Okay, I think we have time for like 2 more questions,
Okay.
and I know she has school and she has patients or something.
This is great.
This is great. So from Joanne, my diabetic dad has been using steroids for a long time for the ulcers on his leg. He got off the steroids, used a lotion that's anti-inflammatory and moisturizing, but it resulted in his skin becoming thicker. Why did he get that reaction with the lotion?
Perhaps he's allergic to the lotion, certain ingredients in the lotion. It was good. I mean, you must remember medications that you're using, or lotions or topicals, can have a two-edged sword. It has a moisturizing effect that is good and therefore will improve the skin. But on the other hand, it might have a chemical ingredient in it that you're allergic to, and so
that's
therefore
true.
it worsens the thing,
Also,
So-
if he's coming off of steroids, remember we talked earlier about how long-term topical steroid use can really thin the skin.
Yeah.
And when getting off of topical steroids, we actually have a live about that. It's not uncommon to have a rebound effect and go through steroid withdrawal, and the skin can rebel. It's like really pissed off at you for stopping the steroids, and it can get really angry. So I don't know if he's already been through that thickening. I wonder if that could be part of the rebound.
Not only that, in diabetes, by the way, it's one of those
right.
diseases which has a lot of skin lesions associated with the disease diabetes itself. Like, for instance, there is the skin spots that can occur. There are blood
Patches of
vessels, what you call the
dryness.
microvasculature. That's why the tiny little blood vessels can be affected by the diabetes in the skin and make them more prone to certain kind of skin condition, including ulcerations. So you have to consider, especially a diabetic on steroids. I mean, that's kind of,
That's
anyway.
complex. It
complex.
requires real
Is that a
management. No,
Oh, okay.
real management and real digging into the history.
Okay.
Okay, I think this will be our last question. Can allergies cause cystic acne or acne in general?
Allergies can produce acne of two kinds. One, the adult type of acne. We call it adult type of acne, but it's no longer secondary to the hormonal changes that are trying to make you into a grown woman, to young girl, to be an adolescent, right? So this is called adolescent acne. It's basically hormones. Your hormones are triggering it. However, there is the adult acne, and in the adult acne, you can have clogging of the pores due to certain things that you're doing to your skin. So yes, you can have. What was the question again?
If allergies can cause acne.
If allergic, yeah. So therefore, in an allergic reaction, if you're using steroids, it can produce steroid acne. If you're thinning your skin so that the barrier is impaired, and then you're putting things that are clogging the pores somehow, you can have acne secondary to that. You can have a condition called folliculitis, which is really not acne, but I tell you, it looks very much like acne. We see it all the time. Acneiform lesions,
Right.
from sweating.
So it
or
seems like it's not necessarily the allergy
the,
that we're
the
all
diagnosis has to be made correctly.
saying. Right, but it could be things you're using to manage the allergy.
Yes.
Right.
And I guess, I mean, if you run it through, right? So, for example, the contact dermatitis. If you have contact dermatitis, and which can therefore affect, which can be because of barrier issues, that you might have sort of multiple things happening to your skin at the same time, where your skin has barrier issues, and that might be causing of acne, and it can also be causing of contact dermatitis. It's not necessarily that the allergy is what causes the contact
right.
dermatitis.
The
It's just that you
changes.
have an underlying issue of your skin that makes you more likely for both.
There you go. Okay. On that note, I'm gonna let you guys go.
You're going to let us go? We're having a fun time. Can we stay, Mommy? Can we stay?
Your patients will get so mad at me, and your mwah, and your school, mwah, love you, mwah.
Thank you.
Thank you. I'm so happy you got to join us, Cece.
Yeah,
Yay!
really happy to see you.
Oh golly. Okay, so I'm gonna run through this real quick. I know we have people waiting. So again, sort of in a nutshell, if you prick tested positive for something, chances are you can use it still on your skin, unless you've also patch tested for it. To help, my sister was talking about how it can sometimes be hard after a patch test to know if an ingredient is a cross-reactant of another ingredient. So you can contact us with your patch test results, and we can help customize recommendations for you based on your results and possible cross-reactants. Don't forget all the stuff that's happening online at vmvhypoallergenics.com. You get a Re-Everything Eye Serum when you shop a Re-Everything Eye Serum. We're giving away a starter kit of the Moisture Rich Super Skincare line. And in the Philippines, we're giving away a starter-sized skincare fave when you shop at our skin specialist boutiques. And don't forget, please, to let us know what else you'd like us to talk about. If you're in the Philippines, if you'd like a patch test or a teleconsultation with my mother or a dermatologist or nutritionist we work with, drop us a DM. And, what else was I going to say before I forget? Right, our winners, which is fairly important, for a Red Better Cream Cleanser today. Congratulations, and thank you to Linda Williamson Bronars, Arlene Orencia, and Anna May Canlas. You get a Re-Everything Cream Cleanser, which is pretty awesome. So there, I think we're done. Please don't forget to join us next week. I think we're going to be responding actually to an article in the New York Times about coconut oil and some of the stuff that people talk about it being bad as opposed to good. So I think it'll be an interesting discussion, and we'll really go through a lot of the history. Like us on Facebook, subscribe to our YouTube channel. We're putting up content every week, and follow us on Instagram. And yeah, thank you so much for joining us. This was a rare treat to get my mom and my sister here, and yay! And don't forget to ask questions, and I go back to Facebook to try to answer questions that we didn't get to today. So keep them coming, and definitely let us know if there's like reaction videos you want or anything that you'd like us to cover. Thank you, and have a wonderful rest of your week. Bye, everybody.